As a physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis. Can physiotherapy make an impact on someone suffering from this condition, in particular mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. A scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one part of the multidisciplinary network of healthcare professions employed in the treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for any abnormalities and asymmetry. If scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle, or severity of the scoliosis. From here, physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward. I believe a good, multifaceted approach to this is ideally broken down into 4 distinct phases. The first of these, in my program, is pain relief. Although not all scoliosis sufferers will experience pain or even discomfort, many do, and for these patients, the provision of pain relief assists with compliance and also with corrective or prevention exercises. Physiotherapists have a variety of techniques for achieving this, such as the releasing of tight muscles through gentle massage, acupuncture, the use of supportive postural taping, and various electrotherapy modalities such as ultrasound. Phase 2 is a particularly important step for several reasons. It's for rectifying any imbalances through stretching and strengthening exercises. This often still includes taping techniques until strength and flexibility have increased. Physiotherapy here focuses on both sides of the spine as well as adjacent areas like the hip or shoulder, depending on what's impacting spinal alignment. The aim is to restore the range of motion of the spine, muscle length and strength, as well as endurance and core stability. This stage is paramount for allowing ongoing treatment in phase 3 to occur. This is because it's there that the patient requires the strength and flexibility gained in phase 2 in order to resume normal activities. These include sport and recreation, which is the objective most patients have in mind during the treatment process. It's where we aim to restore full function. This is where we, as physiotherapists, need to tailor rehabilitation to the specific patient so they can safely achieve their functional goals. This, of course, includes trained athletes who place great stress upon their bodies, so caution must be taken when giving advice, and strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions may be utilised. For example, in a case of an unequal leg length, a podiatrist could address this with a heel rise, shoe rise, or built-up foot orthotic. What patients expect to achieve and what is achieved varies greatly. However, those with mild to moderate scoliosis who have a commitment to maintaining their newfound strength and flexibility can expect a full recovery, especially if diagnosed and treated early. Physiotherapy is a vital part of this recovery and prevention and should never be underestimated. So, the next time you're asked, "Can physiotherapy help my condition?" I'd be inclined to give a firm nod and respond by saying, "With your commitment, physiotherapy is invaluable."